Well, if you are anything like me, then your smartphone is probably permanently attached to your hand. It's practically another limb, except one that can do much, much more. From the first days of the phone, our reach has begun to expand beyond our home, across our neighborhood, to across the country and around the globe, and now even beyond that. Smartphones have revolutionized the way that we see and interact with our world, but this cell phone renaissance is certainly not over yet. Developers are now crossing signals with the medical field. This is an ultrasound device run by a smartphone. It was invented by a mobile health company known as Mobisante, and it brings the world of digital imaging to your smartphone or tablet. Now, if you think that's impressive, you ain't seen nothing yet. To talk more about this digital revolution, I'm joined now by Shiv Gaglani. I hope I said that right. And he's the editor of Mega Gadget. Thank you so much for joining me.
Thank you for having me.
Can you first explain about how this technology is something that is as commonplace as your or my cell phone, how it is revolutionizing the medical field?
So the smartphone, as we know, when the iPhone came out, we were all very excited about how that's going to revolutionize things like finance and, because people stock trade, they do trading on their phones, to publishing. But healthcare is one that didn't immediately get impacted, but now it is because sensors have become cheaper and we're able to collect a lot of clinically relevant data just using your iPhone as the processor or Android phone and a few other cool gadgets that you can add on.
And I understand you have a few of these cool gadgets yourself. What did you bring us?
Yeah, so I brought a couple of gadgets just to show you. This is the Massimo pulse oximeter. And so a pulse oximeter collects your oxygen saturation, and you actually just plug this into your phone.
I'm assuming it's an iPhone.
It's an iPhone, yep, exactly right. And so it gives you your beats per minute, your heart rate, as well as your pulse oxygenation. And that's important for patients who may have things like chronic obstructive pulmonary disease or pulmonary fibrosis, as well as people who want, mountain climbers who operate in low oxygen environments. This one has gotten a lot of headlines. This is a live core heart monitor. And so it looks like a case, and you essentially just plug your phone into the case. But if you were to hold it, and we could do a demo if you'd like.
Sure, why not?
Just hold it like this, and just hold your hands steady, so one on each, exactly like that. And I'm going to turn on the phone I have attached to this other device, which I'll show you in a second. And this collects your one-lead ECG, so basically how your heart is operating.
This is essential. Oh, wow, you can see it right there.
Right, yep.
And this is essentially revolutionizing the way that we look at medicine. So that is quite an impressive thing. What else did you bring us? Right,
so this, I already have my phone attached to it. So this gadget right here is actually, a lot of ophthalmologists use it. It's called a ophthalmoscope. It's from Welch Allyn. And what they've made novelty here is they have a case that your iPhone plugs into, and I have mine right here. And it uses the phone camera to take a picture of somebody's eye.
And I think we actually have one of those pictures.
Right.
Jonathan, can we show that picture? I think it was of my eye a little bit earlier today.
Yeah, no, it's very easy to take pictures.
There it is right behind me, my eye.
Right, and so you can see the back of your eye and obviously track if there are any problems, but yours look pretty normal.
All right, that sounds good to me. I hope you wouldn't tell me anything on air if something was wrong.
Not at all.
Okay, we're talking about all these different medical devices and the way that they've revolutionized technology. These are things that can be used anywhere and that have really brought doctors this much closer to understanding the human body and hopefully cures to a lot of different things. But let me ask you, I mean, obviously these things are wonderful to have, yes, but where's the line between a patient having this and a doctor who is certified, who knows what he's looking for, having these devices? And will it eventually deter patients from actually going to the doctor in the first place?
Well, so I hope not, because I'm a medical student as well, and I want a job.
You need some money.
Yeah,
right? Some money.
And so I don't think we're going to reach a state where patients are just collecting all of their data. So this week at TED Med, actually, here in DC, we're having a big conference. We're showcasing 10 of these devices. Some of them are things patients can and will use at home, things like collecting their weight, which is pretty easy to do, and they can do it accurately, as well as their blood pressure. And actually, it's a better thing for healthcare if these patients are tracking those statistics, because rather than just getting one-time measurements once a year, they're able to get longitudinal measurements, which give us a better indicator if they have high blood pressure or they're obese and things like that. But there are some devices that, like this Welch Allyn ophthalmoscope, which I don't really see patients really using. Like, I mean, how many patients will take a picture of the back of their own eye and then send it in? I see them being used by trained healthcare professionals in low-resource settings, but I think what we want to make sure is that patients are empowered, but not empowered to the point where they don't think that they need professional medical help.
Sure, and let me ask you one more question. Now, obviously, when tobacco and cigarettes came out in the beginning, nobody really knew the health consequences of them. Obviously, we learned differently. Now, when cell phones came out, we heard that they could cause cancer. There's a lot of evidence that doesn't say that, but then there's some evidence that might. Yes or no, could this potentially have long-term effects on us?
So I can't prove that. I can't say yes or no. I've been trained to sort of equivocate on that as a medical student, but I think that we'll get more data on it. I don't think these devices will.
All right,
Yeah.
Shiv Jalani, editor at Mega Gadget, thank you for joining us.
Thank you.